My name is Haley Packer, and for my career in-depth overview, I'm going to be covering the field of dermatology. Dermatology is the field that studies and treats conditions of the skin, hair, and nails. A dermatologist is the doctor that specializes in these performances. More often than not, however, dermatologists don't just stick to general dermatology. They complete fellowships, which is additional schooling, to specialize in a more specific area. For example, I am planning on completing a fellowship in procedural dermatology, which means I am more concerned with studying, diagnosing, and performing surgical treatment of diseases of the skin. Being a dermatologist is an extremely daunting task, as there are a lot of factors you have to deal with. When you are hired as a dermatologist, you are expected to conduct skin examinations, diagnose and treat various skin conditions, perform biopsies and skin surgery, and conduct clinical research. During these tasks, you also have to make decisions and solve problems, communicate with your superiors and patients, identify objects and events that are happening or have happened, prioritize your work, and think creatively in certain situations that require it. This job also entails you to be extremely responsible, as you have to be able to handle a high level of social interaction, be extremely responsible for the health and safety of your patients, be responsible for work done by other members of your staff, and handle your placement in conflicting situations. More often than not, we also have to be wearing safety attire the entire day, work indoors, occasionally be exposed to the contaminants or hazardous situations, and come in close and physical contact with patients. Dermatologists must be very exact and accurate, be able to do repetition of the same mental and physical tasks, make impactful decisions, and make nearly all decisions and set goals/tasks for members of your team independently. And you have to do all of this with 40 hours per week on a set schedule, and you may be on call. A dermatologist must have values that include investigative interest, social interest, realistic interest, achievement importance, good working conditions importance, recognition importance, relationship importance, independence importance, and support from your employer importance. Dermatologists must also know medicine, customer and personal service, English language understanding, biology, psychology, administration and management, education and training, and therapy and counseling. To become a dermatologist, you have to have a high school diploma or equivalent, complete a bachelor's degree in either biology, physics, or chemistry, graduate from medical school, complete an internship, pass a state licensing exam, complete a residency program in dermatology, and pass additional exams to become board certified. Once you get the job you want at the hospital you want, you still have to complete 75 hours of continued medical education every 3 years to renew your license. But as a dermatologist, being able to communicate is also important, as well as having a problem-solving ability, being able to use math and science, having the ability to manage yourself, people, time, and things, be able to work with people, and have perception and visualization abilities. In high school, taking the classes I list will be able to help you get a basic understanding of what dermatology might entail. Anatomy and physiology, child development, computer application, food and nutrition, foreign language, introduction to healthcare, nursing, safety, and first aid. There are benefits for doing all the work to become a dermatologist, however, the main one being your annual wage. In the United States and Minnesota, dermatologists typically make over $208,000 per year. This wage increasing if you complete fellowship programs to enable you to perform more tasks within your field. Once you are at college, there are many programs you could be a part of that would help you get into dermatology, those being medicine, osteopathic medicine, biomedical science, biopsychology, cancer and oncology biology, emergency medical care, gerontology, neuroscience, pre-medicine, and public and community health. Colleges that offer these kinds of programs include the University of Minnesota, which is where I plan on going, or at least trying to apply to, but also the Boston University Medical Campus is very well known. This concludes my in-depth overview of dermatology.